Hello guys. So here we are with our quick bites. So in relation to medical science and boxers, we have got certain named conditions. Let us wrap up them together. Boxers fracture, you all know, is fracture of fifth metacarpal. Okay. Then come to boxers attitude, which is also called flexion attitude or vigilistic attitude. And this is an attitude which is both antemortem and postmortem phenomena, because what is required for boxer's attitude or pugilistic attitude is extensive heat. Whether the person is alive or dead, that does not matter. So due to extensive heat, what happens is coagulation of muscle proteins, and that leads to flexion of major joints, called as boxer's attitude. Then in relation to boxers, acute boxing injury leading to death, what is the most common cause of death? So in acute boxing injury, the most common cause of death is subdural hemorrhage, SDH. But what is the name given to boxer's hemorrhage? Boxer's hemorrhage is referred to as pontine hemorrhage. That also we should remember. Now, a boxer is suffering repeated blows over the head, and after a period of 10 years, 12 years, he is going to die. Then questions are asked, what is the most common cause of death in relation to chronic boxing injury? So chronic boxing injury is also called as dementia pugilistica or punch drunk syndrome, where the person most commonly dies due to brain atrophy or cortical atrophy. Okay, so stay tuned for more such updates. Bye bye.